everyone, Dr. Mark here. I wanted to make a quick video talking about how the novel coronavirus or SARS-CoV-2, the virus that causes COVID-19, affects the heart. I think there's still a lot that we don't know at this point, but it does seem that the virus can affect the heart in a few ways that we know about. First, if you are someone who already has coronary artery disease and you get sick with the virus, the stress that the infection can put on the body can essentially cause a heart attack by putting too much strain on the heart when there's already a pre-existing blockages in the coronary arteries. A second way that the virus can potentially affect the heart is essentially by causing so much trouble with the respiratory system that even without pre-existing blockages in the arteries of the heart, you can essentially have a heart attack because there's so much of a strain on the respiratory system that the body's not getting enough oxygen, and that causes what we would call a type 2 heart attack, which basically means that there's evidence of damage to the heart muscle that comes from a supply-demand mismatch between the amount of oxygenated blood that's needed and the amount that's available. And again, that can happen even without there being blockages in the arteries. If you watched my other video about what is a heart attack, I alluded to the fact that there are actually multiple types of heart attack, and again, that would be considered a type 2 heart attack. And then the third way that it seems to affect the heart is that somebody who has an infection with the novel coronavirus can actually get an inflammation of the heart muscle from the virus, and that is called myocarditis. That can actually can be quite severe and can cause a severe weakening of the heart muscle. Along with that, when there's that inflammation of the heart muscle, you can get certain abnormal heart rhythms along with that. That is actually not unique to this coronavirus. There are a number of viral infections that can cause a myocarditis, but it has been seen with the novel coronavirus as well. Beyond that, I would say that I guess the last thing to mention is that there can be an indirect effect on the heart by the virus, and that is people who are having the more run-of-the-mill typical heart attacks and other issues with their hearts are tending to stay home for fear of getting the virus and trying to stay out of the emergency room and hospitals, and that's understandable, but I think unfortunately that is causing some people to sit at home with heart attacks and other heart issues for which they should be getting treatment. So I think if you are suspicious that you're having a significant heart issue, you probably are still better off going and getting it checked out rather than staying at home. Hope that you found this information helpful, and if you have any comments or questions, I'd love to hear them. Thanks for joining me.